Modern medication did not work for me. Modern medication did not work for me. Modern medication did not work for me. Modern medication.
Hello, greetings. Welcome to Mercy TV Live, your medical cannabis call-in show. My name is Perry, and along with Sunny, we'll be hosting this segment of Mercy TV Live. Please call in at 503-588-6444 with your cannabis-related question. Comment, curse, or kudo, what have you. Tonight, before we get into the details that we normally discuss here on the show about folks getting their cards and getting medicine now, and where do I, if I want to get growing for myself, what do I need to do with that? I want to take a moment to talk about an issue that is really important to the medical cannabis community. The DEA is on a big drive to suppress a hemp bill that is in the U.S. Congress. And it's important so folks contact their U.S. representatives and tell them to vote yes on hemp. Now, what it means to the medical cannabis community is that this is the Drug Enforcement Agency who's got their hobnail boot on the medical cannabis community's neck. They're the ones that are raiding people, they're the ones denying cannabis as medicine, and doing their best to prevent dispensaries and other things that make the programs work for folks, not just here in Oregon, but across America. So you can take a big bite out of the DEA there by getting this hemp bill to pass. The hemp issue is really the key of the issue. It's actually more money involved than in the pharmaceutical side and all the other things combined. And another issue that you're liable to hear about, again, courtesy of the DEA, is that the proliferation of hemp crops is going to destroy the medical cannabis crops by pollinating them. And, a couple of items that should be pointed out is that we've got some feral hemp around now. We've got cartel gardens of many thousands of plants out there now. So there's enough pollen out in the air, really. I don't think the threat level is going to go up that much higher. But even so, we're going to end the war, and I think that we're going to be able to grow more medicine as a result, and that's going to outweigh the negative effects of hemp in Oregon. The DEA's primary argument, and you want to educate your representatives in the U.S. Congress on this, the DEA is claiming that drug dealers are going to be growing their recreational marijuana in amongst the hemp plants, and that the cops won't be able to tell the difference between the two. Now let's break down that lie into its parts. Number one, the DEA is telling us that a plant that is grown specifically to be seedless is going to grow up in this hemp plant crop with all the pollen flying around and not go to seed. And I'm having a real hard time imagining how in the most bizarre scientific story you could create this immaculate conception. Oh, non-conception is where. We have a phone call though. We're going to go to that momentarily. Go ahead, caller.
Hi there. I want to make a testimonial that cannabis is good medicine.
Okay, well, go ahead, caller.
Well, I use it in a healing oil that I run off my joints to relieve the pain. I eat and I enjoy smoking out of a bong, water pipe.
Well, those are all good ways of medicating. The oil process is one that we really try to promote and educate folks about because they're a big concern about smoking. And this oil process can be used topically in many cases, and in that case, it's you're not getting high, you're not cupping that buzz.
Well, and for all of those that are watching the show that don't really know what this show is about, it's about cannabis, marijuana, that everybody has told us all of our lives is bad for us.
I just wanted to give you a call to tell you you're doing a good job and keep it up. And I wish more people wouldn't be afraid to call and give their testimonial.
Okay,
well, we sure appreciate it.
Thank you, caller.
Thank you.
Spread the word.
And see, it's those kind of calls why we're doing the show, because there's people out there that are afraid to use it, that all they know is bad. And you know, if you're one of those that have thought nothing but bad, please stop, look into it. There's a lot of people. Come by our office Monday through Friday, 12 to 6. Every kind of person that you can think that has issues with pain, with nausea, seizures, cancer, epilepsy, glaucoma, AIDS. These are all the things that people are having issues with. And you know, if you have been on all those drugs, which takes me to the hospital, if you're one at the hospital that's watching and nobody's told you about marijuana, that said cannabis was good for you, please talk. You have to be the one to initiate that conversation. You are the one, because tonight you got to hear the show. And if you tell your doctor or your nurses that I really need to use cannabis, I need to look into it, maybe they will help you. Come by our office, give us a call. Every Friday night we're here doing this show. People need to learn that cannabis is good for you. There is no risk, there's no worry. Everybody's like so freaked out because of all of the reasons they're gonna get sick, they're gonna get too high, they're gonna do all these things, like the gentleman that called. The oil is just rubbed on topically, and all it does is relieve the pain and the spasms in your legs and arms and neck and shoulders and feet, wherever you're hurting. These are the things that are going on. All those people sitting at the hospital are going, this is not possible. There is no way this little thing that I'm talking about could work when they've had all of these drugs and all of these side effects. And now somebody's going to tell them about some oil they can rub on. I know it sounds not true, but it is true. It's not that it's going to take the pain away completely. It'll be able to deal with the pain, put it on the pain scale where you can deal with it and not get sick from all the side effects that all these pills have. That's one of the things that people really don't understand is about the side effects, Barry. Side effects are good.
Well, yeah, they don't understand a number of ways. They don't understand the side effects from the pharmaceuticals. Many times they're not adequately educated as to what's going to happen. The doctors, the pharmaceutical companies are certainly not very forthcoming about all these things side affecting. At the same time, the so-called side effects of cannabis, many of which are non-existent. You know, cannabis supposedly kill you. No, not the case. No one's ever overdosed from it. No one's even with allergic reactions to it has it killed anybody, harmed it. The side effects are things that we're looking for. You know, it brings you an appetite. These are folks are not eating.
Well,
it puts you to sleep. These folks aren't sleeping.
That's what we're seeing. PTSD just got added as a condition. All of those people have sleeping and eating issues. Other people have lots of sleeping and eating issues and end up on a lot of pharmaceuticals that really mess them up, and they end up getting so bad, so many side effects, and so worse in their condition that it's not even the condition, it's the pills that they were taking for that condition. Yeah. And today, if they get some cannabis, all of it will go away and they'll be back at their condition, their poor old good condition that they wish they had to begin with. And I've been there and I've talked to people that have been there, and you know what? Are you one of those people? You need to come by, you need to call, talk to your doctors, talk to your family, friends, your husband, wife, your brother, your sister, your mother, your father. These are the things, you guys. Nobody is telling us that we need to do this for us. We're letting all these pills and pharmaceuticals and let the doctors tell us, come on, take it. It's okay. These side effects are worth the risks, worth feeling better. Well, that's not the case. It ends up happening is we feel really worse, really bad for a long time. We keep taking pills. We keep trying new experimental things that will make us feel better, and it don't work. But yet, you can eat some cookies, you can rub some oil. People think smoking and vaporizing. Vaporizing is hot air. There is no smoke. It might look like it, but it's a vapor, and there is no smoke. And if you talk to your doctor and he is aware of cannabis, he will tell you that vaporizing is good. Because all of the doctors I've talked to, Perry, know that vaporizing is actually good because it is oxygen. And there is no
Right.
burning, all of those bad things, the carcinogens that go along with burning. And this is what we're trying to do, is educate people that way, because eating and rubbing it on and the tinctures under your tongue, these are the things that people need to take advantage of to try and have a quality of life that they've had not a chance to up to now.
Yeah, for sure.
It always takes them. They got to be driven to their last rope, and this is it, cannabis. I got to use cannabis. Well, I know it's been bad for me. I'm going to get hooked.
A number of cases. Some cases, the folks, they've got friends and family that already tried it. They know, so they know, as soon as the problem's occurring, as soon as they're diagnosed, they're down at the center trying to get their card. And at the center, you're going to get, it's not just get your card here now. What about tomorrow? What are you going to do
Right.
for your grow? What about my job? What about the kids? All those
We've
things,
really got a lot of that lately. And people with children should not worry, because you're not smoking around your children. You have a room where you can smoke that your children don't go into. All of your medicine, all your pipes, your lighters are all in that room. The room is locked. If you are doing that and CSD comes into your house, believe me, this is what they're going to do. They're going to look through all those bedrooms, the bathrooms. They're going to look for medicine. They're going to look for pipes. They're going to look for lighters. Anything that they could find to show that, like, you're using this medicine or whatever around the kids, that's what they're looking for. But when they don't find it, because they open up your room where the medicine is that's locked, they're going to walk away. You'll get a letter in the mail saying there is no case here. That's because there is no case. If you're being responsible, and like most of the people that I'm running into for all this time for the cannabis, they are responsible. They're trying to be good parents, patients, adults, part of the community. That's why I'm here. That's why Perry is here. You guys, we're not bad people. There's a lot of good things going on with cannabis, and nobody is taking the time to share all of this good information that maybe it's not you. Maybe it's your mother, your brother, your father, your sister. Maybe it's your neighbor. Maybe it's a person at work. I had a lady come in the other day and tell me that she asked this person at work about cannabis because she has cancer. She's been living with the cancer treatments and trying to make it to work, and now she has got a cannabis card and it's working for her, and she can't believe how her life has changed. I mean, that's a blessing. Only people that have cancer and go through all of it know what I'm talking, but if you're that person, you know what a blessing to the quality of your life to be able to eat and get some sleep and go, man, as bad as these treatments are, at least I'm able to eat and sleep a little bit, because that's what happens. You end up not sleeping and eating, and the treatments become unbearable.
That's a vicious cycle. And when the side effects of the pills and more side effects is thrown in on top of it, that's what really deteriorates folks' quality of life. The stress, the lack of good food, nutrition, the lack of good sleep, just creates a whole cycle, a downward spiral that, there's your slippery slope right there. So.
Well, and nobody's talking about it because nobody is aware that cannabis is truly the good medicine, that we're speaking on it.
Well, they're not, Big Pharma's not talking about it. Hell, they're suppressing the information. And any information about cannabis that's, released or allowed on mainstream media is through the propaganda filter. So, folks are going to have to get out there and get the information. Come down to the Mercy Center, grab a bunch of the literature, take a bag, show folks. Look us up online, mercycenters.org. Come on down, though. Talk to the folks. We got volunteers down there Monday through Friday, noon to 6, helping folks to get their card, to find medicine now, to get growing or to find a grower, and these best methods on medicating. We're talking about the vaporizers. We talked about the oil. There's also can of butter, and they're very simple to make, really.
Well, and people, if you are one that has no idea and you're worried and scared and there's too much, there is no worry. People, there's volunteers. Everybody that we deal with are really having an opportunity to help others, because maybe you're one that needs to help, or maybe somebody helped you. This is what we're doing. We have all of these things going on to help others. Maybe you got something that you'd like to share on TV about your condition. Talk to us. We'll get you on TV. If you don't want to come on the live show, we'll do a taped one. We can do a taped one at the office. We are trying to get all the information out so that somebody, if it's not you, maybe it's your brother or sister or your neighbor, and they'll see you and hear you and say, wow, I kind of believe what he's telling me, because everybody that we're getting information from says cannabis is really working. So if you need it and you don't know how to get it, there's a doctor. The doctor will see you. You have to get your medical records together, though, and we can help you do that. We'll call. You can have doctor fax them to other doctor. You know, all of these things are available and are happening so you, the patient, can make this a better quality of life for yourself, and where you thought it was so hopeless. That's where I keep seeing the biggest problems, you guys. Everybody's telling me about how hopeless and how depressed and how bummed. You know what? You got nothing but everything good. Cannabis relieves a lot of issues. It helps you with your eating and your sleeping, and once you start eating and sleeping, then you have some energy. Once you have some energy, it allows you to be able to get up and do some things. That's the biggest things with all these conditions. People don't have no energy. So they get to where they feel like they're isolated and depressed and they have no energy. These are the things that cannabis will do that will help build your quality of life, that will get you away from all of those things. I'm sorry, you're still going to have cancer. But if you're going to have it, at least be able to eat, be able to get some sleep, and get up tomorrow and go, man, I got to face today. You know, a lot of people don't understand about why cannabis is now coming legal. Well, because it really does work. People think all of the money issues and all the law, political, like Perry was talking about the hemp issues. Mm-hmm. There are so many issues between the hemp and the cannabis for medical and all that, that I see it as a political division between all of us in our society, when really you should be taking advantage of it, he should be taking advantage, I should be taking advantage, and there should be no problem. But we see a lot of problems for all of us, Perry, to take advantage. And this is what we got right now. So if you got some questions, please call, please come by. We're open Monday through Friday, 12 to 6. We have Wednesday night meetings at 7 o'clock.
I was going to say that's another good time and place for folks to come by and get information, find out about all these issues that we talked about, getting your card. It's free and open to the public, so I mean, you don't have to be a card holder to attend there. And find out how to get your card. Match up to a grower at the same time. That's a real difficult thing for a lot of folks. That's one of the, if I can't get the grower, then there's no point for me joining, because the fees are so incredibly high, and we're working to try to get them down, but it's going to take everybody to do that. So come on in and find out. Come on down to the Wednesday night meeting or sometime during the week. Wednesday night meeting has happened at 1745 Capitol Street Northeast. Start at 7. They go till about 9ish. And not only do we go over the issues about getting your card, finding medicine now, getting to grow yourself or finding a grower, and the best recipes and other formulas for the medications and stuff, but action items that are happening here in Oregon State as well as federally. Now, one thing you can do out there, you folks can do right now, is contact your U.S. representative and tell them to vote yes on the hemp initiative, the hemp bill that's currently in play there. Yes, that's hemp. There's also several medical ones and legalization bills in U.S. Congress. Talk to them at the same time. But the hemp bill's a no-brainer. If they don't support that one, fire them next chance you get. And while you're at it, then you want to contact your Oregon State legislators. There's a bill in play that's going to allow dispensaries here in Oregon. It's House Bill 3460, and we've had exciting news here earlier this week. Attorney General Ellen Rosenblum has come out endorsing HB 3460, writing letters to the legislators and saying, hey, we need this bill. And indeed we do, because we had a series of raids here in Oregon recently, and those were about 3460. They were targeting people who testified, who were working on getting 3460 passed, and it's actually punishment for getting Senate Bill 281 passed, which is going to allow PTSD, makes post-traumatic stress disorder one of the qualifying conditions now. That's going to take effect January 1st, 2014. But let's not stop there. Let's get this 3460 to pass as well. Contact your U.S. representatives and counter the nonsensical lies that the DEA is telling. The same variety, the same whoppers that they're saying about medical, they're saying there too. They're claiming that the drug dealers are going to grow these seedless plants next to the hemp crop. And then aside from this immaculate non-conception, the DEA is saying they won't be able to tell the difference between these two plants. The one tall, stocky, few buds, full of seeds, hemp plant is going to be looking and smelling so much different than the short, bushy, multi-budded, few seeds as possible if they can arrange it, plant that the professional drug dealer or marijuana growers would prefer. So just say no to nonsensical DEA lies. Contact your U.S. representatives. Tell them yes on hemp and all the other cannabis law reform bills at the federal level. Then contact your state representatives. Tell them yes on HB 3460, which is to allow dispensaries in Oregon. And we'll keep you posted on the other things, the action items, when these folks that were busted are going to have their court appearances. We're going to be doing some fundraising for them. But mostly in 2014, we're going to move to de-elect and otherwise disempower all the officials that were involved in this reefer madness going on here in Oregon. We need to stop it. We need to stop it today. And we need to not only quit wasting money and quit wasting good people through this war, but free up the economics and benefits that would happen to here in Oregon and across America with the end of not just medical cannabis, but prohibition overall. Sonny, we've been dealing with this now almost 10 years through the Mercy Center. All these issues swirling around, and we have a lot of perspective on what the people need and want, I think.
Well, the main thing is this: we have a lot of people coming in every day saying, "Thank you. We would not have done this, went through it, had they not seen the show, seen some people that talked to them about it." So it's important, if you're watching the show, to engage, have this conversation. I know you're worried, you're scared. It really is this: it's your quality of life that's going down the tube. I'm sorry, man. If you don't take a charge and say, "Hey, I heard this is possible, and I'm not even high," and that's what you tell them, "I'm not high, you're trying to feel better," and watch what happens with your life. And when you get feeling better, please come by the office and talk to us. Give us your story. A lot of people don't want to come on TV because they do have fear. But the thing is, they did go ahead and try the cannabis anyway, and look what happened to them. And I'm hearing this all the time because there is a lot of people out there that are suffering with all of these drugs, and nobody's giving them a choice for cannabis. They're finding out through other family, through other friends, through other means that nobody would have ever, and that's sad. That's sad that we as a society would let our fellow man suffer because what? Because the government told a lie a long time ago and they've carried this lie out all these years, so we're going to make everybody suffer now? No, you guys, come on. If you know somebody that's sick, that's having these kind of pain or nausea issues, haven't ate or slept for 15 or 20 years, because that's always how it starts. Yeah. 15, 20 years we haven't ate or slept. And then they come in and say, "I've just got the best sleep I've had in all these years, and I've ate." And then it goes on and it gets better from there. These are the things, you guys, that we as a society need to share with our brothers and sisters. How beautiful that you could tell somebody, "Hey, I know you've been sick, please look into cannabis. I think it might work for you." and watch the things that you can do to help somebody else by sharing that information, even though maybe you didn't believe cannabis was good. You know, that's this thing. Everybody's saying, I didn't know cannabis was good, and now I really do. We have to tell each other and talk to our families, talk to our friends, talk to people we work with. Oh, but I know there's fear. There's fear for all the things from work to doctors to the family.
All right. And we want to take a moment to say thanks to, we've noticed, well, over the years, it's always been a steady stream of it, but hopefully, I'm not just imagining this increase in nurses and doctors that are recommending folks to the Mercy Center.
Oh, yeah.
They're not able to sign the folks' paperwork to help them get their card directly, but they'll give them the information for helping them to get their card.
You know, a lot of people have done that.
That's huge. Thanks a lot. We know that some of the nurses were going around in the hospitals and turning the station, their TVs to this station so folks could see the Mercy TV. That was great. You're beautiful. Thank you for doing that.
Those are the things that people are doing to share with others because they too are scared. But you know what? Please, if you can do that, give this information to somebody that you care about, because the difference in their life that you'll make is unbelievable. Everybody, if y'all went out and started doing this tonight, by tomorrow the difference in people's lives that you would make is unbelievable, because others that don't know about it think you're kidding. Once you tell them about the oils and the tinctures and the vapors, where it's not, it's just air that you breathe in and it's no burning. You know, those are such huge things that nobody knows about, because you wouldn't think that that would take care of you and make you have a quality of life, where all this time you've had no quality of life and nobody ever told you about cannabis. It's very upsetting. Why is something that we do know about that's being kept a secret being held from us so we can take all these pills that we get so sick from? That makes no sense. We can take something we don't get sick from, or take something that they keep selling that we get sick from. It's not cool. People are going to have issues. Please tell them about cannabis. Talk, have the conversation.
Right. We've got to change this ridiculous situation where we've got this thing, this cannabis, and the prohibition of it has killed more of us, more people, than cannabis has. There's something wrong where the thing that you're trying to prevent is less harmful than your methods for preventing it. But it's something that's done to us, and we've got to be the one to fix it.
Well, if somebody wants, please come by. You know, we'll go to doctors for people. We've done everything.
We've got a packet to educate your docket and the sign, but if we won't, we know of all the places. We know the means to help you get your card. If possible. If not, we know the alternatives. You know, you're from defenses, like the folks with PTSD are going to have to practice until January 1st.
Right, because that's when they'll come in.
Right.
It comes into effect in January 1st. Everybody that has PTSD, please get your records together now. So January 1st, you can go to these doctors that will sign for you, and you'll be able to get signed.
Educate your doctor now, sure.
Yeah.
Okay, thanks. So folks, come on down to the Mercy Center there, Monday through Friday, noon to 6. And also Wednesday night meeting, 1745 Capitol Street, Northeast, 7 p.m.
Hey, you know, thanks, Perry. Thanks to all those volunteers here at CCTV and CCTV. We couldn't do it without them.
Gets the show out, gets the word out. We know folks are watching and getting their cards through it. Thank you. Spread the word. Your friends and neighbors depend on you to let them know about it.
That's how we're doing it all together.
Come on down, check it out, help out. The life you save just may be your own or someone you care about.
That's what we need to do. Just reach out and help somebody that you think might need the help. It'll make a world of difference in their life.
And we'll see you next time on Mercy TV. Bye now.
You want to say anything before I turn it off, Glenn?
Yes, good night.
Good night. God bless you all, every single one of you.